that we can hear all of our contributors, so please keep your microphones on mute. Just a reminder that this session is going to be recorded and we'll be uploading it onto our website for anybody who wasn't able to attend, so please do circulate it afterwards to colleagues. We will be using the chat function to take questions towards the end of the presentations, and these need to be sent directly and privately to the moderator, who will then ask the questions of our speakers. So just to make sure everybody's clear on how that works, you can open the chat function at the bottom of the Zoom page and select GambleAware as the recipient for the message, and then you can type that question into the chat function and send it to us. So the host and the moderator will then see your questions and make sure that those questions are repeated to the speakers so that everybody can hear those. If we do run out of time to answer all of your questions, then we will definitely make sure that we try and respond to them later. Please email info@gambleaware.org so that we can get a member of the team to respond. So hopefully that's all nice and straightforward. So I will start by introducing you to our moderator, Simone Vibert, who is from the Children's Commissioner. She's Senior Public Affairs and Policy Analyst there, but she's worked with us previously on developing materials for youth education. And then we will be hearing from speakers including Kenny Amathodon from Clearview Research, Warren Hughes from Fast Forward, Kev Cleland from Weigam, Alexa Roseblade and Lou Mosley from GamCare. So Simone, over to you. Thank you.
Thanks very much, Jane, and welcome to the session today. As Jane said, my name is Simone Vibert. I'm a policy advisor to the Children's Commissioner for England. So the Children's Commissioner's job is to stand up for the rights of children, especially the most vulnerable, and ensure their voices are heard. Our new Children's Commissioner started just this month, and her name is Dame Rachel D'Souza, if you haven't seen or heard of her yet, and she is beginning her 6-year term. You may have seen that last week we launched a big project called the Childhood Commission, which is going to set out what needs to be done to transform children's life chances over the next 10 years. And it will be informed by a survey called the Big Ask, which we're aiming to be the largest survey of children in England ever. So our boss hasn't given us a difficult task to start with. Do get in touch with me if you'd like to hear more about that. But as Jane said, though, I'm sort of here with another hat on, and that's as a former researcher at the cross-party think tank Demos. In 2016, we launched a sort of pilot gambling education project consisting of 4 lessons, which reached 650 secondary school pupils across the country. And those lessons were designed to sort of teach children about the risk of gambling, about where to go for support, and sort of concepts more broadly applicable to sort of risky behaviour in general, such as delayed gratification. So those resources are free online, and they were quality assured by the PSHE Association. At that time, we had 100 schools express interest in taking part. So that really signalled a keen awareness of the risks posed to young people by gambling harms. And as Jane said, we've got a lot of people in attendance today. So I think it's shown that there really is that continued interest and engagement on the issues surrounding young people and gambling. So best that we crack on, because we've got a lot of speakers with really good insights to share. So first, I'd like to introduce Kenny and Kev. So Kenny Amathodon is a social entrepreneur and the co-founder and managing director of Clearview Research. Clearview is an audience insight and strategy agency working with decision makers in public, private and third sector organisations nationally and internationally. Clearview specialise in working on research, evaluation and engagement projects with young people, minority ethnic groups, culturally diverse communities, people with protected characteristics and those who often go unheard. Kenny's a trustee of several charities such as BBC Children in Need, Strength Within Me Foundation, Spark Inside and City Gateway, where he's currently the chair of the board of trustees. He's also on the advisory board of the Her Majesty Queen newest charity, Queen's Commonwealth Trust, and youth charity Peer Power. So secondly, in the session, we have Kev Cleland, who's operations director at the Young Gamers and Gamblers Education Trust, Weigam, and has been with the charity for 3 years. Prior to joining the team at Weigam, he worked for 10 years as a primary teacher, participating in the Outstanding Teachers Programme, which saw him spend 2 terms working in a secondary setting to share good practice. Before that, he was a sports writer working for a number of local and national publications across Scotland. So welcome to you both. Kenny and Kev are going to be discussing their work on young people and ethnic minorities, the differences in prevention methods and the need to bring in experts across all youth and their future plans in the space. So thank you very much, and over to you guys.
Thank you, Simone, and good morning, everybody. So I'm Kev from Weigam, and as Simone said in the introduction, I'm here with Kenny to tell you a bit more about how we're looking to prevent gambling harms in diverse communities. So to start off with, we'll just give you a brief sort of introduction into both organisations and the work that we do. So Kenny, do you want to go first and tell us a bit about Clearview?
Yeah, perfect. Can you hear me, Kev?
Yep.
Yeah, perfect. Yeah, so in terms of Clearview, so we specialize in doing projects around research, evaluation, engagement, and we do a lot of projects where the main people that we work with are like young people, people from ethnic minority backgrounds. We work in a lot of culturally diverse communities, and we work with a lot of people who have protected characteristics and those who often go unheard. And our main mission is to work with decision makers in the private, public, and sectors and tribal sectors as well, just in terms of to help them to make more conscious, more culturally sensitive and equitable decisions.
Thanks, Kenny. And at Weigam, as it says up there, we're a UK charity, and we're founded on the lived experience of 2 people, our CEO, Lee Willows, who worked in the non-formal education sector before gambling addiction took him to the brink of suicide, and also saw him appear in court after stealing from his employer. And then also we've got Anne Evans, a former primary teacher, whose son Alan took his own life 10 years ago after a 20-year battle with gambling, which dated back to his teenage years. As you can see up there, we've got our social purpose, which is to inform, educate and safeguard young people around the potential harms caused by gambling and gaming. And in order to achieve this social purpose, we do a number of things. Now, you'll hear a little bit later on this morning about the Young People's Gambling Harm Prevention Programme that we deliver in partnership with GamCare. Alexa and Lou will be on this session later to talk a bit more about that. At Weigam, that means that we train teachers, youth workers and other education professionals across England, Wales and Northern Ireland, looking to raise their awareness of the potential harms and providing them with free access to our resources that are all mapped to the relevant national curriculum and are being written by our team of education professionals and externally approved. We also work directly with university students and staff and support parents via our parent hub. But the 2 organisations came together because we've got that shared goal to make a genuine impact. Back to you, Kenny.
Yeah, cool, perfect. So in terms of like the why, so for us, and this very much speaks to the reason why we're here today. So we know that research done by Natsen in 2014 very much looked into the gambling behaviours of people in England and Scotland, and it found that amongst adults, when you compared people who were white or white British background, the odds of being a problem gambler were 7.4 times higher among people from Black and Black British ethnic groups, 5 times higher for people from Asian and Asian British groups. And what was really interesting was that despite the fact that participation amongst these people from ethnic minority groups were lower, however, in fact, their chances in terms of becoming at risk were actually higher. So in 2018, GambleAware commissioned Clearview to better understand gambling from the perspective of young people from ethnic minority backgrounds. And these insights would prove to provide a clearer view in terms of on how we can improve how information, resources for prevention, education and treatment are provided to people in these communities. And so really as part of the research, we conducted focus groups and in-depth interviews with a diverse range of children and young people. We spoke to 118 in total during the course of our research. And I'll go on to the next slide, which will kind of speak to some of those findings. So as here you can see, this is based on YouGov's research, not ours, but 1 in 4 adults from ethnic minority backgrounds who gamble suffer significant gambling related harms. We go to the next one, please, Kev. And so this is just something that come out of our research in terms of 95% of young people from ethnic minority communities could not identify how they could access help or gambling harms. So for us, one of the key findings that come out in our research was that there was this disturbingly low awareness of gambling support services amongst children and young people. A lot of them were clearly overexposed in terms of to adverts and marketing to encourage them to gamble, but they had very minimal knowledge in terms of the support services available. And there was even challenges with mentioning support services available even amongst those who have actually worked for gambling operators in the past. We'll go to the next one, Kev, please. And then also this for us was also very interesting. It very much speaks to this whole point of around like the role of religion, culture, and upbringing in relation to people's perspectives around gambling. So here you can see that 90% of young people from ethnic minority communities agree that gambling is seen differently within their cultures than within white British cultures. And for us, this was very interesting because it also speaks to another key finding for us, which was around religion and how religion has a significant role in shaping people's response to gambling and how it can act also as a barrier to conversations on the topic and therefore can actually limit people's awareness and their capabilities to actually understand more about the topic. And then another key finding, which I think is very important, was also to do with what people consider to be gambling was very much determined by the level of skill and risk. And if the level of skill required was low and the risk was low, a lot of times the children and young people we spoke to didn't consider particular activities to be gambling.
Thanks, Kenny. So as we've mentioned already, Weigam's work now covers Wales and Northern Ireland as well as England. And we've developed our resources in the Welsh language, and we also now work with the Youth Work Alliance in Northern Ireland, an organisation that is skilled in cross-community work. This demonstrates that we're always looking to deliver culturally appropriate services, which is why we commissioned Clearview Research to complete 2 phases of work for us at the start of 2020, to look at how we could best meet the needs of those from Black, Asian and minority ethnic communities. The first phase saw us conduct an external audit of the organisation, reviewing Weigam's website, our social media channels, our staff team, our senior leadership team and the Board of Trustees. And the report and the extra materials presented to Weigam in May 2020 concluded that the more the organisation thinks like, not just looks like, its service users, the better placed it will be to help. And only 9% of the voluntary sector workforce is from a BAME background. And this figure decreases significantly in more senior positions. And a more diverse Weigam team will hopefully bring a smarter team and a more creative and innovative team as well. So one of the recommendations that Clearview made was that we recruit at least 2 new trustees to our board who came from a younger demographic and also came from those diverse communities. And that's something that we've done. And those 2 new trustees will bring new skills and expertise to our board as well. And we've also developed our resources significantly over the last 12 months, responding to recommendations made in our impact study carried out by NCVO, the Charities Evaluation Service, developing full schemes of work from Key Stage 2 all the way through to Key Stage 5. Now, these resources have been written by our team of qualified teachers and youth workers, and they've been approved by professionals in the field, but we want to make sure that those resources are accessible to everyone, which is why we also asked Clearview to audit our resources, and we followed up on the recommendations, which you can see up here, and that's culminated in us winning a Children's Young People Now Award for PSHE provision last month as well, something we're really proud of at Weigam. In the second phase saw us work on a co-creation group. We involved Clearview Research here again, and we put together 7 people aged between 16 and 35 from Black, Asian and minority ethnic background to further develop our strategy of delivering culturally appropriate materials and services that meet the needs of those from diverse communities. The co-creation group also reviewed a sample of our resources, and one member of the group, who's a teacher, attended the Weigam workshop before providing feedback on her experience. Now, these sessions took place between May and June last year, and they were 2.5 hours each as well. The findings from these sessions came under 3 categories. So the findings covered research, they also covered employment, about getting the right people on board, and then finally development, about ensuring that the message is right. And obviously it's that case of, so what are you going to do next? And at Weigam, as a result of this work with Clearview and also with Clearview's input, this week we've announced plans for the Preventing Gambling Harms in Diverse Communities initiative, where Weigam and Clearview are going to work with 2 community interest companies, TalkGen and Redcard Gambling Support Project, to deliver free specialist workshops to young people from ethnic minority populations aged between 14 and 24, as well as free training, specific targeted training to community and faith leaders as well. Now, this 2-year pilot that will initially cover London and the home counties will see TalkGen and Redcard collaborate to create young person facing educational content, including some culturally specific gambling harm awareness short films, as well as self-help information and age appropriate signposting material. Whilst Weigam will focus on training community and faith leaders who, once trained, will deliver our resources to the young people that they work with as well. And then Clearview's role in this is leading on the creation of a theory of change model for the programme, ensuring that not just the outputs are right, but the outcomes are correct as well. And also they'll act as independent evaluation partners. On top of this, we're looking to put together an advisory group, which will also be established, and we'll be looking to recruit members to this group in the coming weeks. Anything to add about this piece of work, Kenny?
No, I think that you've covered most of it. So we can answer most people's questions when we get to the Q&A. But I think that's it. I think we're on time. Yeah, I'd like to think.
And finally, if you do want to find out, there is obviously the opportunity to ask questions at the end of everybody's presentations this morning, but there's an email address there as well. You can direct any queries about this programme to us. Okay.
Thank you very much. Thank you very much, Kenny and Kev. What an interesting collaboration. It really comes across that you're both very committed to this agenda, and the fact you're going to be continuing working with each other for the next however long is a sign that it's been a really good piece of work for you both. So great. Okay, well, moving on. It's my pleasure to introduce Warren Hughes next. So Warren Hughes is from the organisation Fast Forward. So Fast Forward is a Scottish voluntary organisation that exists to enable young people to make informed choices about their health and well-being. In 2018, Fast Forward launched the Scottish Gambling Education Hub, a programme aiming to make it possible for every young person in Scotland to have access to gambling education and prevention opportunities. For the first 2 years of this project, Warren worked as a project officer within the hub, leading the organisation and delivery of gambling education and prevention training for staff in high schools, colleges and universities across Scotland. In 2020, Warren took over as a project manager and works to maintain Fast Forward's role as the leading gambling education and prevention programme in Scotland. So welcome, Warren. I think you're going to be talking, explaining a bit more about Fast Forward and the work of the hub, prevention via youth professionals, online delivery during COVID. It's taken us 23 minutes to mention COVID, but here we are, and signposting services in Scotland. So over to you, Warren.
Super, thanks very much, Simone. So yes, well done to Kev and Kenny for keeping within time. I hope to do the same, and it will be a very much whistle-stop tour about what we do up above the border. And as Simone said, we are the Scottish Gambling Education Hub, a programme run by Fast Forward, and I am the project manager. Fast Forward, to give a little bit more information about the charity. We are Scotland's national youth work organisation specialising in risk-taking behaviours, harm reduction and early intervention. Gambling isn't the only thing we do. We have programmes and projects on substance misuse, on tobacco education. We focus on effectively all risk-taking behaviours with a harm reduction approach. The reason we use this approach is we see it as a pragmatic, a realistic, but ultimately an effective way to minimise the harms associated with these risk-taking behaviours, including gambling. As Simone mentioned, the aim of the Scottish Gambling Education Hub, which was set up back in 2018, is to make it possible for every child and young person in Scotland to have access to gambling, education and prevention, resources and opportunities. Now, we've only got a team of, well, it's 6 now, it was only 5, and so that's no small feat. But to do that, we offer training to almost any professional that works directly with young people. We focus on training youth workers, youth employability staff. We work in schools, colleges, universities, as well as supporting family services and services to support parents and carers. Additionally to our training, we also run the Scottish Gambling Education Network, which is quite a mouthful, so we like to call it SGEN. And in SGEN, we run quarterly meetings, which are all digitally now. We also have a monthly newsletter, and we support and consult with our members on on gambling education across Scotland. We also produce the Gambling Education Toolkit, which has information and resources available for free for anyone that's looking to do some work around gambling education and prevention in Scotland. There's information, there's support services available, there's sample session plans, one-on-one activities as well as group activities, and it's all tailored towards the curriculum of excellence and youth work outcomes in Scotland. Our approach with our training is multifaceted. We provide training, but also policy consultation. We're about to submit our response to the Gambling Act review. We build the capacity of organisations across Scotland, as well as looking at peer-led inputs and producing educational resources of all different sizes and shapes. We combine both our national outreach with local initiatives. We have small pots of funding for local youth groups if they want to create their own gambling education or awareness initiatives. We have a public health approach. We've recently been accredited by the RSPH in terms of our public health approach, but we recognise that in all of our webinars, and it's something that we really promote across Scotland, that gambling should be considered as a public health issue. As I mentioned, we promote harm reduction around gambling, and harm reduction is something that across Fast Forward is fundamental in everything that we do. But it's all evidence-based. All of the research that we do, all of the education prevention that we provide is based on research and evidence. So for the first 16 months, and that's quite a specific number, and I'll explain why, but for the first 16 months of our project, we delivered 209 sessions to practitioners. This is a picture of one of those sessions. As you can see, some of them were tailored in-house sessions for organisations. Some of them were more regional sessions that one or two from various organisations could attend. Over those 209 sessions, we trained 1,402 teachers and practitioners across Scotland over all local authorities. And in terms of the impact, 99% of staff that attended our trainings and filled in our evaluation said they had more confidence and skills to deliver gambling education and prevention to the young people that they work with. It's also good to mention something else that we did, which was develop a theatre production that we toured around schools across Scotland. It was a gambling awareness theatre production followed by a facilitated session where we posed thought-provoking questions to the young people that watched the performance. We travelled around over 100 schools or high schools across Scotland and reaching over 15,000 school pupils. As well as that, we asked the teachers the impact of those, and 4 in 5 teachers that observed and followed up from that performance said that the play motivated them to address gambling as part of the prevention work that they currently do in school. So that takes us to, as Simone said, sort of the dreaded C word, coronavirus, which did have a massive impact. Everything that we did was face-to-face. Our theatre production tour got put on hold, all of our training got put on hold, and our team at the time weren't equipped to be able to move everything online instantly. But it did take us only 6 weeks to shift everything to online delivery. After those 6 weeks, we started delivering webinars. We had regional webinars as well as bespoke in-house sessions where we provided training to the sectors that I've listed before. To date, we've delivered 108 webinars since coronavirus, or since I think our first one was at the very start of May last year, and we've trained 1,048 staff. We started using a interactive presentation software just to have a bit of a USP, because so many webinars are in existence at the moment. But this interactive presentation software allows people to interact with questions that we ask. It allows people that are perhaps more introverted, that don't want to speak on camera, to still put in their ideas. Just one question that we ask is, what words come to mind when you think about gambling? And you can see some of the suggestions that our attendees have thought of during one of those sessions. But it's really important, and we've received some great feedback regarding that approach in all of our webinars. In terms of our SGEN meetings, we've shifted everything online. We've now done 3 quarterly meetings. This is the agenda of our last meeting in January, which you'll see Kenny and Kev also presented at, so thank you for that, as well as other experts presenting their impact and what they've been doing, especially in Scotland, to minimise gambling harm and to approach gambling harms across the country. As well as our gambling education toolkit, which is predominantly activities that can be delivered in person, in classrooms or in youth work organisations. We've developed a digital youth work pack, a digital youth work resource, to be able to facilitate gambling education online. Now, we are going to be setting up sessions where people or youth workers can come along and watch kind of how to deliver these sessions. But it's a way to make gambling education accessible even during this time, as we know the impact of coronavirus has seen increased profits in the gambling industry, has seen gambling activity largely shift online. So we still have a place for gambling education and prevention. So since moving online, what impact have we seen? More than 9 in 10 of respondents of our surveys felt but more confident recognising the signs of gambling harm. 3/4 of respondents felt more confident delivering gambling education and prevention activities online. And the vast majority of respondents felt more confident signposting young people to gambling support services if they require them, which is incredibly important to us. Here's a quote. Since everything has went online, your input has been one of the best. I have since spoken with the year head for first years, and we plan to add it in once the kids are back full time. Personally, I've learned a lot from today's session, and it was more than useful. We've received lots of quotes like this, and obviously it does sort of blow our trumpet, but I think it's really important to show that proactive approach. Once they've done the sessions, they are taking that away and using the information, the knowledge and the skills they've learned to be able to deliver that and hopefully improve the kind of landscape in Scotland to minimise gambling harms. 100% of practitioners say that attended an online session would recommend the webinar to a colleague, and 99% felt they had more skills and information required to deliver gambling education and prevention activities with young people than before they attended the training as well. Going forward, we hope when things go back to normal, not just to stop our online input, we hope to have a kind of holistic approach where we look at online to help support those perhaps in more remote locations, as well as back to face-to-face, because we don't think it should all be online. We think there's still a place for face-to-face training as well. As Simone mentioned, there is specialist support in Scotland, some specific to Scotland. Citizens Advice Scotland provide training in gambling support to help frontline workers recognise and support people experiencing gambling harms. The RCA Trust is an excellent organisation focusing on treatment for those experiencing gambling harms, providing counselling, and they've got a lot of gambling experts within that organisation. GamCare also have a young people service that I think you'll hear about in the next presentation. And Gamblers Anonymous Scotland also provide a forum for individuals who've experienced gambling harm to share their experiences and help others. But ultimately, we always refer to the National Gambling Treatment Service and the National Gambling Helpline as the first port of call for anyone that is experiencing gambling harm. And I think I might have gone over a little bit, but thanks very much, everybody, for listening. That's my email and my Twitter there. Please do get in touch if you have any questions at all.
Thank you very much, Warren. And I think you did keep to time, at most a minute or two over. I think it was really impressive, obviously, the diversity of Fast Forward's work and the Hub's work in this space, and really interesting to hear how you'll be retaining some aspects of sort of online delivery. And I think that links to the first speakers we heard in terms of making sure gambling prevention and education is available to everyone. So really interesting. Okay, moving on to our final presentation before Q&A. So delighted to introduce next Alexa Roseblade and Lou Mosley, who are both joining us from GamCare. So starting with Alexa. Alexa is a senior program manager in the youth program at GamCare. She's worked in the third sector for 10 years, joining GamCare in June last year. Alexa spent much of her career working with young people in disability and health settings, and is a passionate advocate for accessible programs and education for all. Having scaled up national education programs in the past, Alexa is keen to use her expertise and the strength of GamCare's partnerships to deliver lasting impact for the Young People's Gambling Harm Prevention Programme. And secondly, Lou Mosley. Lou joined GamCare in April 2020. She's a senior service manager in the Young People Service at GamCare. She has over 30 years experience working with children, young people and families in both voluntary and statutory sectors. Since joining GamCare, Louise has been instrumental in developing the Young People Service. She has extensive safeguarding and domestic violence experience alongside numerous parenting programme accreditations. So welcome to you both. Thank you very much for joining us. And I think you're going to introduce GamCare to everyone on the line, and also share a journey of a young person, a sort of case study through your service, which would be really interesting to sort of understand. So over to you, Louise and Alexa.
Thank you. Let me just share my screen. Great. So I'm going to kick off talking about the Young People's Gambling Harm Prevention, focusing mainly on the education and the training side of things. And then I'll hand over to Lou to look at the support side. So our programme is very new. We started at the beginning of 2020 and we're going to run for 4 years. It's something that we're really proud of, that we run our programme in partnership. So it's GamCare, our local delivery partners, and Weigam. And we're working together to deliver a programme of education, training and support for young people across England, Wales and Northern Ireland. So what we're hoping to do is together, we're going to raise gambling related harms as an awareness. We're going to empower young people to make safer choices and seek the support that they need. So broadly, we cover 4 different areas. So we have education and training for 11 to 19-year-olds. So this is kind of interactive workshops that we give directly to young people. And obviously they've been adapted for COVID, and we'll talk a little bit about how we did that in a minute. We have professional training. So this is CPD accredited professional training, and it covers direct training to professionals, and then also, as Kev mentioned at the beginning of his presentation, resources and kind of train the trainer models, so professionals can go out there and deliver education to young people directly. We also have a range of different kind of websites and resources for parents and families. So Weigam run the Parents Hub website, which has loads of resources and information, and GamCare has the Big Deal website, which is aimed directly at young people. And then also really recently, at the end of 2020, we developed age appropriate support. So that is the Young People Support Service, and Lou will be talking a little bit about that later. So this stat at the bottom is really important to us because this is one of the main reasons that our programme exists. So 90% of the people that we work with say they haven't received any training relating to young people or gambling before they came to one of our sessions. So there's a real need, and we really want to change that by the end of our 4 years. So our programme looks pretty much like a journey for our audience. So we train the trainers, we raise awareness, we deliver workshops directly to young people, and then we also provide age appropriate support. So since the beginning of 2020 and throughout COVID, we have managed to deliver to just under 7,000 young people directly, and we've reached around 300,000 people, young people. We've trained just under 10,000 professionals, and we've launched our first young people support service dedicated to young people. So, like many services, we were impacted by the COVID restrictions. 2020 was a really tough year for outreach and education in general, but we tried to use this as an opportunity to develop our joint service and our partnership working and lead on some small scale innovations and reach people in new ways. So as Warren was saying, we had to pivot to online delivery. Most of our delivery previously was face-to-face. And we had to amend some of our traditional delivery models, so shortening sessions and looking into different ways of delivering online. We've developed a joint theory of change as a partnership to encompass all elements of our programme, so that when we're looking to evaluate, we're making sure we cover everything and not just certain kind of sections that different organisations run. We've embedded young people's voices in our programme and made that really the core of our work. We've forged strategic partnerships across many different sectors in the UK, from kind of sports sectors all the way across to trade unions. We've conducted audience studies and research, so really tried to find out what our audiences want to hear and what they want to know. We've redeveloped our young people's online hub, so our Big Deal website is currently under development and will be looking to be released very soon. And we've developed a digital tool to help young people and to support them, and that's one of the things that Lou will talk about in a minute. So it's been a tricky 2020 for most people, but we are really proud that we have worked in partnership and we've kind of delivered some really great results for the young people and the professionals that we're working with. So 98% of the young people that we delivered to felt more able to make informed choices after they've attended a session. 96% agree that they understand how gaming and gambling harm can impact them or others, and 96% agree that they understood the financial risks of gaming and gambling. So it's been a bit of a tough year for us in terms of education and training, but I think we've got some really good results that we're particularly proud of. I'll hand over to Lou now to talk through the support service elements of the programme.
Thanks, Alexa. So GamCare recognised really that we were doing a great job along with Weigam at providing education, support and training, but actually when a young person did have a gambling related harm or was at risk of gambling, there was no specific specialist support. So as part of this programme, we have developed a young people service, and the aspiration of that young people service is that anybody who is at risk or have developed a problem or are affected by somebody else's gambling can access age appropriate support. Next slide, please, Alexa. So we've developed a service that provides a range of support options, ranging from advice and guidance right through to some real structured, tailored support and working with other agencies. You know, we recognise that young people that may have a gambling problem or issue, it's not usually the only thing that's going on in their life. So we take a real holistic approach to really understanding that young person. And I think key to that, when we're working with young people, we listen and we understand the needs of young people. You know, that young people are absolutely at the centre of their support, and wherever possible, they're leading and directing their support. We want to work collaboratively with them and not just do to them and give them direction of what they need to do. And wherever possible, we want to work collaboratively with family members and their support networks, although this doesn't stop a young person accessing our service. Next slide, please. So we wanted to make the service as accessible as possible for all young people. So our only referral criteria is that somebody's worried about their own gambling or the gambling of somebody close to them. We do want to have those small conversations. We do want it to be accessible to all, no matter how big their worry is or how small their worry is. Our referral pathways are really simple. We've really tried to break down barriers. You know, we take referrals from the education and training leads. We can take referrals through the National Gambling Helpline, and the young people particularly like the netline aspect of that, where they can type and have a conversation through type rather than actually picking up a phone and having a verbal conversation. Young people themselves, you know, they can ring us directly. We do have a direct phone number and a direct email. If they want to get in contact that way, they can. They can also access us all through the Big Deal website and just leave us a contact form, really, and we'll get in touch with them. Health and social care, schools and colleges, our brilliant partner providers, and parents and families can all get in touch with us. The only thing we ask when we're getting a referral from another agency is that young person knows about the referral and they know we're going to call them. We try and make it really accessible in that we'll give them a text first, we'll communicate in the way they want to be communicated with. I think one of the key things with this is we've never been a face-to-face service. So COVID really didn't have a massive impact on us. We were always going to be an omni-channel support service. We cover the whole of the UK and Northern Ireland. You know, we've got a small team at the moment, so everything was always going to be online. So it's worked for us, really. Next slide, please. I thought it'd be really nice to hear one of our case studies and really get a feel for what we do, because I think going through this will answer lots of your questions and see the sort of support we're giving to young people. So this was a young 15-year-old lad who was living with his mum and 2 siblings, and it was his mum that contacted us initially with concerns around his gambling, but he knew about us and was happy to talk to us. There was a bit of a family history in that his older sibling had got involved with gambling and he'd seen some of the fallout from that, but some of the big wins equally. And this 15-year-old had been gambling for about 2 years. He'd started when he was 13. Over that period, he'd lost between £1,500 and £2,000, so quite a lot of money for a young person. But he was making money at school. He was selling sweets in the playground, and he could make, you know, some significant amount of money doing that. Mum did chat with us. She was concerned about how aggressive he got and how difficult he was to manage and how challenging he was when she talked about gambling. But this young person really had an aspiration. You know, he wanted to go on. He recognised that gambling wasn't in his best interest and he wanted to go on to be a professional sports player. Next slide, please. So we completed a comprehensive assessment with the young person. Note the word with, we did it together with that young person. We used the outcome star to help us get a baseline of where that young person is, but also inform our comprehensive assessment. So we looked at gambling, and he'd used his older siblings' details to get into accounts. But he did have a specific thing he liked gambling on, and that was sports. We looked into his well-being, which was generally good, except for this amount of guilt he felt because he just didn't want to let his mum down anymore. Friends and family, his family were really supportive, and we had a network. And when we're working with young people, we don't always have that. They're quite embarrassed about it and quite worried about telling their nearest and dearest about their gambling. But in this case, we've got a supportive family. He'd got a really good relationship with his mum, but wouldn't talk about his dad. So finance and money, we delved a little bit deeper there, and we looked at where he was getting money from. So he'd got a number of sources, his pocket money that he was getting from his mum each week, and he'd got this mega amount of money he could make a week at school by selling his sweets, which at the moment's not happening, which was probably a bonus, you know, something that COVID brought on. He had a little bit of insight, and he only had a cash card, so he couldn't do online transactions, and that's something he'd changed before he spoke to us. Education was good generally. He liked school. He had the opportunity to make money, and he excelled at sports, and he had aspirations to get his GCSEs, although dyslexia did present a few problems. Next slide, please.
Just to interject briefly, Louise, I think we are running a little bit behind time now. So if you could,
I will round it up for
that would be lovely. Thank you so much.
So we listened to him, we built a trusting relationship, we increased his knowledge around gambling related harms, we explored triggers, urges of gambling, and we developed a smart action plan between us. Next slide. So this is what worked really well. It was about that relationship, that trusting relationship, the non-judgmental approach, the flexibility, the language we used. We don't talk about support, problems and treatment, we talk about support and worries. Taking an interest in that young person, not just specifically gambling. We had a few issues, you know, young people, counselling sessions, having other priorities, but generally it worked really well. Next slide, please. So this just sums up how many avenues we have and how many ways young people can access our service and professionals. Thank you for listening.
Thank you so much, Louise and Alexa. I think we could have gone into that case study in even more detail, but shame that we just don't have time. So we'll rapidly move on to questions now, because I think we've got about up to 10 minutes before the session wraps up. So the first question I've seen, and I think this is relevant to all of you, so perhaps we'll go in the order in which you presented. It's from Martin Jones. So he says, thank you for your sessions. Can you explain what impact your work has had on the actual prevalence of disordered gambling in children and young people? So do you have any data, for example, of like the indications of when the number affected might be halved? So it's really about getting to the impact in terms of actual level of disordered gambling. So perhaps we could start with Clearview and Weigam with Kevin Kenny on that question.
Yeah, so I'll go first, shall I? And then Kenny, you can maybe input. Obviously, the piece of work that we're here to talk about today is working with diverse communities, and this is something that we've just announced this week. I think probably speaking for the Young People's Gambling Harm Prevention Programme, that's a 4-year programme. And Weigam have just finished year 1 at our side, and GamCare are just approaching the end of year 1 at their side as well. So in terms of the impact, we're looking to get both programs are going to be independently evaluated. So we're going to also carry out longitudinal research as well, looking at the real impact of our work. And I suppose really the answer is that proving the impact so far, that's something that we're hoping to do over the 4-year program, and which is why we've committed to a 4-year program, because we appreciate that we're not going to change this overnight, that we're in it for the long haul.
Great. And Warren and or Louise and Alexa, would you like to come in as well?
Yeah, okay, I'll jump in. I think that's me here. So in terms of fast forward, we focus on the early intervention and prevention of harm, which by nature it's we come in before. Often people have gambled, or the awareness is there, or anything like that, to help minimize harm, and that's incredibly difficult to measure the kind of the reduction in disordered gambling, as Martin put it. But we have been sort of assessing and following up, and actually part of our work is we are interviewing, and we've started this just recently, interviewing some of the young people that have been that have received training as a result of our program, as well as directly from us. And the results of that, I believe, will come out in, as we are a GambleAware funded program, will come out in a report following the end of our project, which will be towards the end of this year. So other than that, I can't give much evidence. But in terms of the initial exposure, it's the positive signs are good, and what we can look at is looking at the attitudes and the confidence and the knowledge around gambling, and what the initial signs from those are really positive in reducing gambling harm.
Yeah, just to add to kind of what Warren and Kev have already said there as well, you know, the data that we have on young people and gambling is quite low, it's quite scarce in general. So it is difficult for us at the very beginning of our programs to kind of show that increase and that kind of change that we're making. And as Kev said, it's a 4-year kind of program for the Young People's Gambling Harm Prevention Program, and we are looking to kind of get that externally evaluated and to look at the longitudinal side of things, especially with lose service and kind of really showing the impact that a dedicated service for young people can make. You know, we're looking at things like numbers of people trained. So I think the stat we shared in our slideshow earlier, around 90% of people not having any training or awareness, there's now, you know, 10,000 more, you know, professionals that do have that training and awareness. So the really kind of early sign indicators that, you know, we're helping to kind of sway things the way we want them to go in terms of people having that awareness and that change in behaviours happening.
Great, thank you everyone. Sorry, Louise, was that you?
I was just going to say, in relation to specifically to the Young People Service, we're using the outcome star as a method of evaluation and impact. The service is very new, so data is limited at the moment, but that will give us some really good impact data on that young person's journey with us.
Great. Next question is from Katie Fry, who says it's great to hear about all the good work going on to reach young people. She asked what the challenges have been and what the lessons learned have been. So perhaps it would be good for each presenter to say one thing that hasn't gone so well and that they a lesson learned perhaps. So should we start again with Kevin Kenny? Put you on the spot there, haven't I? You're on mute, Kev.
I am on mute, thank you. Thanks, Simone. Yeah, in terms of the challenges, I think obviously we've heard it mentioned throughout today. COVID is a big challenge, and it's almost a year to the date since at Weigam we made that decision that we were going to take our training online. I think in terms of the challenge that we faced, it was ensuring that we still covered enough in terms of our content, and we still managed to get our resources out there to the professionals who are working with young people. So that was the big challenge, in ensuring that it was still a priority for teachers during lockdown, that they were going to use our resources when kids were being homeschooled, etc. I mean, I've got two of my own who have been homeschooled throughout that period. So in a first-hand experience of the pressures that teachers are under. One of the positives for us, though, is that 86% of the professionals that we've trained have said that they've been successful in terms of implementing our curriculum and resources. And we've had over just under 3,000 resource downloads as well. So that's a positive. It was a challenge, but I think all the organisations on this session today, and also, I mean, Katie's from Citizens Advice, and they do great work as well. And we've faced up to that challenge.
Great. And Warren, in a nutshell, what's the challenge been and what have you learned?
I'd say it was probably the challenges before the coronavirus challenges, which we all know, would be the awareness and recognition of gambling as an issue in the first place. Every professional or organisation that we work with, it was a battle to include gambling or even train them in the first place. We're offering free training and free resources, and they would be asking for substance misuse resources, alcohol and tobacco, but gambling just wasn't something they wanted. We really had to battle. One change in that, I mean, the theatre production that we produced was a big moment when that was something new, and schools loved theatre production. So when we were able to talk about that really helped, as well as some of the other kind of new USP innovative resources that we produced. But it's still a challenge and something that we work hard to overcome.
Finally, Alexa, Lou, whichever of you would like to come in on this.
Yeah, so I think challenges, you know, as everyone said, COVID really difficult. And I think that impacted both the formal education, but also non-formal education routes as well. So youth groups, kind of scouts, guides, brownies, all of those places where traditionally we would be able to go in and engage with people and see young people directly were kind of affected as well. So that has been difficult for us. I think something that has come out of this quite strongly has been collaboration and partnership working, and people being really open to that idea of working together to get greater kind of impact and outcomes for the service users and the young people we're trying to reach, as well as digital developments and kind of creativity. I think COVID forced everyone to think outside of the box, and to kind of, really kind of acted as a catalyst for some of those digital developments that maybe we wanted to do, but we're a little bit on the back burner beforehand.
Great. We're rapidly running out of time, I'm afraid, and still lots of questions that we would have liked to have covered, but I think there is facility, if you haven't been able to ask a question, to email GambleAware, and they'll be able to give the details for that. So it will just leave to me briefly time to wrap up and say thank you very much, firstly, to all of our speakers for taking the time today and getting through so much material. In just an hour, we've covered research, we've covered prevention, education, referral, treatment. We've talked about COVID, making services accessible to all young people, and including listening to the voice of young people. That came out really strongly in that final session from GamCare. And also touched on the future in this space. So the Gambling Act review is ongoing. There is change on the horizon. And I think in that question and answer session, something that was raised was by Warren, I think, there were lots of problems before COVID, and it's, in terms of youth and gambling and education and prevention and the entire piece. And I think it would be a mistake for us to pretend, play into this thought that everything was rosy before COVID, and it's COVID that's disrupted everything. We still need to make sure collectively that young people and gambling are on the agenda. So a really fantastic session. Thank you very much to GambleAware too, for putting this together and getting these great speakers together in the same room to cover so much material in such a short space of time. And thank you, of course, for attending. And we're at 11 o'clock now, so I'll close the session and let you get to the rest of your day. So thank you very much.
Thank you.